Did you know that approximately 10 to 12% of the US population, over 35 million people, deal with TMJ and TMD issues? And if that's you, or you're wondering if maybe you have TMJ, then stay tuned, my friend, because this is the episode for you. What's up, everybody? Welcome back to another episode of Your Mouth Matters. Of course, I'm here with the knowledgeable Dr. Rebecca Taylor. Dr. T, how you doing?
Wow, what an intro. I'm doing great.
I just try to top it every week. I try to come up with something even
Yeah,
better every week.
I can see. I can't wait to hear what you come up with next week. I'm excited about today. This is something that I have personally struggled with. I've had TMJ issues. In fact, that's part of why I went down the rabbit hole of figuring out how am I going to treat this and how am I going to basically treat myself, make myself better. So just a little bit of a brief history on this. When I was a kid, I went through braces. I had braces twice. My mom is a dentist, and she did everything right, everything that she knew how to do. So I went to the very best orthodontist at a very young age. They were very proactive. They put braces on, and then those braces came off, and then they put braces on again. It must have been right in middle school, 7th grade, I think, 6th or 7th grade. I started to get these debilitating migraine headaches. My migraine headaches were so bad that I would lose 2 weeks of school. I'd miss 2 weeks of school because I would have to stay in my bedroom with the lights off. I didn't want to watch any movies or screens because that would make it worse. The light and the movement would make it worse. It was so painful. I would basically put my thumbs and try to gouge my eyes out because of the pain from the headaches that I was having. And so I suffered with pretty severe migraine headaches. And that happened right after my braces came off. And my parents, of course, were like, oh my gosh, what's going on? Nobody thought that this could be a jaw issue. Nobody thought it could be because of the braces that I had. And so I went to doctors who basically just prescribed me medication. And by the way, migraine medication, I don't know, back when I was a kid, it really sucked. It didn't really do much. It took off the edge so that instead of you wanting to kill yourself and jump off a building, you were like, maybe I won't. But it was like a maybe, right? It still really didn't take away the pain. And so even with medication, I still would miss school. I still would have pain, and anything would just somebody, if I was sleeping and somebody would walk in and turn the light on, that would just flare up my migraines and I would be out for a week. So anyways, I suffered from really severe migraine headaches when I was in middle school. And my mom at that time was a dentist, and she had started to go to the Las Vegas Institute, which is called LVI. And LVI is an institute that teaches dentists, and they have a neuromuscular approach to treating TMJ and also just in general. When you're restoring somebody, if you have somebody that has really worn down teeth, we got to build those teeth back up. But where do we position the jaw? So the concept at LVI was that the muscles are what causes the pain. 90% of the pain that we have is caused by muscles because that's where all the nerve endings are. And bones and all that don't have the nerve endings. So symptoms are coming from muscle dysfunction. So they were really big on we have to get the muscles of the face and the jaw relaxed, and then the symptoms will get better. And it just so happens that migraine headaches can be a huge symptom when it comes to muscle dysfunction in the jaw relating to TMJ and TMD. So my mom, going to these classes after I had experienced headaches for a couple of years, decided, you know what, we really have nothing to lose here. Let's try to let me treat my daughter. Let me treat her jaw. And she did her whole thing. She did what her class taught her to do. We did TENS, we relaxed my muscles. We ended up making me an orthotic and made my teeth a little bit taller. And that seemed to get rid of my migraines. And I didn't have to take medication anymore. And it was crazy. You think in your head, did I just grow out of them, or did the dentistry actually get rid of my migraine headaches? So anyways, because of this history that I have a lot of passion around this topic, and it's something that I really dedicated my own studies, the classes that my mom took at LVI and all that. That was many years ago. And since then, we've learned so much more, and we've really evolved out of a classical neuromuscular thought. There's so much more that goes into it than just screening muscles. That's a really important piece, but there is so much, like how you design the bite, how you design the orthotic, the way in which your jaw moves, the prescription that's really built into the bite, and the functionality of the way that the jaw moves and how it moves and what teeth engage at what time. Those are all really, really important when treating TMJ. And those are things that my mom, when she was going through her training, they didn't really talk much about. That's not really a traditional neuromuscular approach. So I dove in, and then I dove even deeper because it's really important to me that I'm able to treat people just like me, right? I see kids all the time that have had braces taken off, and then now they have extreme pain or headaches or whatever. And we basically have to go back, we have to stabilize the joint, and we have to start over again. So anyways, I want to dive into TMJ or TMD. People say that they have it. They know that they have it, but there's also some other symptoms that might surprise you that you may not. You said, Barry, that what was like 10% of the population has TMJ. I would say it's probably more than that, and I'll tell you why in a few minutes. But I think a lot of it is just awareness, right? Like in dental school, we are never really taught how to treat TMJ. The medical doctors used to be in charge of treating TMJ, and then now it's on the dentist, but in dental school, you get very, very limited education on treating TMJ, which is terrifying because we're working on teeth all day long. People's jaws are open all day long, and we're causing all this muscle strain, and then we don't know how to fix it, right? Our dentists don't know how to fix it. I had one of my friends recently, actually, I treated her jaw issue. She had a lot of clenching and so she told me that she had waited for 3 months to go see a specialist, a TMJ specialist at a university. And it took 3 months for her to get into the specialist. And so she was waiting patiently in pain. And she finally got in to see this TMJ specialist who's teaching all these dentists at a university. And the guy told her the reason why she has clenching and grinding is because she moves her jaw too much. So she should just stop moving her jaw so much.
That makes no sense.
I'm like, the jaw's supposed to move. We talk, we eat. It's supposed to move. So how can you tell somebody that they shouldn't move their jaw? That's insane, right? This is the guy that's teaching our dentists out of dental school how to treat TMJ issues. Wow, what a fail. What a fail.
So in that case, when you're looking at TMJ, you have brought up a couple of different scenarios, and just to help clarify for our listeners and people who are going through it. So in your personal case, you didn't have any of these issues prior to the braces. And then after the correction, and we've talked about this on other podcasts where you'll have stuff like braces that go in and are they're correcting a visual appearance or a straightness or whatever, and then they'll correct for all these other factors in terms of bite. So then TMJ came after the fact, and then with some of these additional early on treatments that your mom and you guys went through, you're able to find some relief. Now other people can just develop it over time. Is that more like your friend who just developed conditions over time? It wasn't necessarily.
This is why when you said before, oh, there's 10% of people, this is why I'm like, no, I think it's more. And I'll tell you why. So the jaw joints, so we talk about TMJ, we're talking about the jaw joints. Okay. So the jaw joints are right in front of the ears. Okay. That's where the lower jaw hinges and translates. Okay. So you get the movement. The lower jaw is basically attached to the skull with muscles and ligaments. Okay. And there's a joint right by your ear on both sides. And that joint should sit on a disc. Okay. And that disc, so when you first open, your jaw joint is going to rotate a little bit. And then it's gonna be sitting on this disc, which is going to act like a slide, and it's going to slide down. And that's how you can open your jaw. And that's when you open your jaw, your jaw kind of hinges in it and it slides and it goes back, right? So there should be this nice smooth movement. Now, if your jaw for some reason is not on that disc, so if it's not on that disc that allows for that slide gliding movement down, then what happens is the jaw starts to pop and click. So you'll get clicking and popping. Clicking and popping means that that jaw joint is going on and off of that disc. And then that disc is not perfectly around that joint. Okay, so that's like one of the earlier signs. Now, if you're clicking and popping, that means that you're still on the disc. But what happens over time is that disc will end up getting pushed more and more off of the joint. And so now you don't have any disc anymore. And so a lot of people will have clicking and popping in the beginning. When they're younger, they have clicking and popping and it'll go away. And then they're like, I used to have TMJ, but now I don't have any TMJ. Actually, you have more advanced TMJ issues now because that disc is completely gone. It's where is it? We don't know. The reason why I think more people have it, so you can have it and you can have symptoms of it, but you may not know that those symptoms are coming from your jaw. Okay, and this is where dentists don't really know, chiropractors, they don't understand this either. And so it becomes very hard. You know, a lot of people will send these TMJ cases. They're like, I have all this pain or I have these things, and they'll send them for a psychiatric evaluation, or they'll just medicate people with pain medication. Fibromyalgia, for example, is a huge, that to me, if you come in with fibromyalgia, I'm looking at your jaw, I'm looking at your bite, because that can be, fibromyalgia can be a symptom of TMD, TMJ dysfunction. Things that I always screen for when I'm talking about symptoms would be like headaches. So do you get headaches? How often? If you're getting headaches every week, or you get headaches frequently, then we need to look at your jaw. We need to look at your bite and the jaw and the functionality of it. Do you have pain in the jaw? Is there any clicking and popping in your jaw? Limited jaw opening. So you should be able to open your mouth pretty wide. You should be able to fit at least 3, if not 4 fingers in your mouth. Everybody do that now. Okay. So if you can't fit easily 3 to 4 fingers, then that is a sign that you have limited jaw opening. And so that would be another sign that there could be some TMJ dysfunction happening. A lot of times ear pain and congestion is actually caused because the jaw joint is positioned posteriorly. And so if you have ear pain or congestion, it just doesn't resolve, that is another sign of maybe a TMJ issue. Vertigo, dizziness, also symptom of TMD. So these are things where if you got vertigo or dizziness, you wouldn't necessarily think, oh, maybe I have a problem with my jaw. You would maybe go see your chiropractor, or you go to your medical doctor, and your medical doctor would be like, we have no idea. Here's some medication, right? So
let me just tell the story. I have a good friend, someone who I won't, they'll know, no names will be named on the podcast, but whom has had a lot of neck issues, and those neck issues have now started to translate into jaw issues, and they see them as one and the same. And that has led to clicking, popping, severe migraines, inability for the jaw to fully open, frozen jaw, so it gets stuck. And my friends have been going to see the chiro. Oh, I just need to go get another release. I need to go get another release. And I'm like, I don't think that, listen, you've gone to get your neck worked on every week for months, and you still have these issues. This is definitely not just your neck. And I'm like, this is when they need to come see you.
You need to come see me. That's classic, yes. And here's the thing with the chiropractor is able to adjust the spine. But if the cranial strain is happening because of the bite, or the way that the teeth come together, or the relationship between the top jaw and the bottom jaw, if that strain is coming from there, you're never going to touch that with chiropractic. In fact, you'll be married to the chiropractor. You'll get some release, because remember, all of the muscles in the upper cervical spine are linked back up to the jaw. So if you have like a tightness here in the neck and you fix it, that's great. But if the cause came from the jaw and the way that the bite closes, that's just going to throw that spine out again. And we see this in our x-rays. We'll take x-rays of people and their spine will be completely crooked. We do no chiropractic. We just change the bite using our orthotic, and we'll take a scan several months later and that spine is completely straight. So we're literally doing chiropractic adjustments with the orthotics that we're using for TMJ, right? Treatment. So they're all linked together. And I think this is where chiropractors need to know when they need a dentist to get involved. If you're a chiropractor and you're doing chiropractic treatments and that person is not getting better, if they're not better, if they still have to come see you every week because their neck goes out or their jaw, whatever, and you're doing this every week or two, and that's what the patient needs, and so that they can function, there is something bigger going on. I'm not saying that there's, oh, like a chiropractor can't fix this. Of course, there could be other things going on in the spine that chiropractors are excellent at treating. But if you have a patient that's, I'm just seeing that chiropractor and it gets better, but then it comes back and I just have to go, and you're that type of person, or you're not getting that immediate relief, then you got to put your thinking cap on and think, okay, there is something else going on here. This is a jaw issue, most likely. And yeah, vertigo, dizziness, tinnitus is another big one. Tinnitus is huge. How many people do you know that have tinnitus?
So
A
many.
lot of people. Difficulty swallowing, clenching. Clenching is huge. Now, clenching is actually linked to the pelvis being rotated. So whenever we're working with anybody that's clenching, usually I'm going to need a chiropractor to help line up that pelvis. And those are harder cases to treat, a clenching case. Not impossible, but you got to do that co-treatment with a chiropractor. Bruxing, so clenching or grinding your teeth. If you grind your teeth, that's another sign of TMJ. And that also is a sign that the upper cervical spine is out. So clenching is a pelvic issue and grinding is more of an upper cervical issue. So we would need to combine chiropractic when we treat these cases if we have clenching or grinding, okay? Pain in the temples, any kind of facial pain, top of the head pain, back of the neck pain. If you have really tight shoulders, if you hold your tension in your upper cervical spine, or you have forward head posture, all of these are signs that you have an issue with your bite, and you could have some TMJ issues going on. Tingling in the fingertips, also a sign of TMJ. If you have facial asymmetries, that's another sign that there could be asymmetries in the way that the jaw is opening and closing and the muscles, and so you could get some of that. If there is a poor facial profile, so if you have a jaw that's protruded, if your lower jaw looks like it's back, if you look at pictures of yourself and when you see your profile, that lower jaw looks like it's back and you don't love it when people take pictures from you from the side, that's another red flag of having some TMD issues. If you have snoring, that's another thing. We snore because typically our jaw falls back, and when the jaw falls back, the muscles can get irritated. And so snoring and mouth breathing are also potential signs that there could be some TMJ issues going on. There are other things too, like even thyroid is linked with TMJ. Anyways, there's the symptoms are so much more than just jaw pain, right? And I think that that's something that most of the public does not understand. And that's why I said, I actually think that more people have TMD issues. I have very few people that I look at my office that I go, oh yeah, your jaw looks completely normal and fine. And the reason why this is happening is because TMJ issues happen when the lower jaw is positioned usually back in the socket. And the reason why the jaw joints are positioned back in the socket and why we're seeing more of that is because the top jaw, the maxilla, is not developed properly. So over 80% of people have a deficiency in the maxilla, which is the top jaw, and the way it grows. Most of that growth happens before age 8. So we're talking about, like, we are way, way back, right? This is when you were a kid. Your bones didn't develop properly. And why did that happen? A lot of different reasons. Most of it is from diet and nutrition, and not even what you had when you were a baby. This is from what your mom had and what her mom had, right? We're talking about this many generations of a deficient diet are causing us to be more inflamed. So what happens is kids are starting to do mouth breathing because the adenoids in the tonsils are enlarged because of an inflammatory diet and inflammatory environment. For example, if, let's say you eat perfectly, I have a lot of moms that do all of the right things, but their child is still mouth breathing. There could be something else going on. There could be mold in the house. There could be, your kid could be very hypersensitive to pollen. You could have a gut imbalance that makes it so that your immune system is not functioning correctly and you hyper respond to things, right? And there's also genetic things as well, which our diet and nutrition and our environment can change. So when we have all of these things working against us, right? Our world is pretty dirty, right? We're constantly around toxins, we're eating crappy food, we're not usually eating the raw milks and all of the food that's in season and not sprayed and not genetically modified. Even if you try to eat clean in this world, it's almost impossible, right? Our water's full of stuff, our air is full of stuff. So our bodies are just getting bombarded. And so what's happening because of that, what's happening is we start to see kids mouth breathing. And what happens is that maxilla doesn't grow properly because the maxilla, the top jaw, needs the support from the tongue and the breathing through the nose to grow properly. Okay. And then when that doesn't grow properly, we end up getting airway issues. The nose and the maxilla grow first, and then they grow, and everything remodels forward, and that opens up the airway space. But if that maxilla doesn't grow if it doesn't come forward and grow properly, your airway is going to be restricted. And now your lower jaw, in order to fit in that upper jaw, has to go back. So if you think about it, it's like a clog shoe, right? You have a clog and you're trying to put your foot in. Guess what? That foot, if it's too big, is going to stick out the back. And so that's what's happening with our jaw, is that the condyle, the joint, has to basically, you have to function, right? You have to chew your food. This is survival. And the body is very smart and it adapts. So when you have a top jaw that's underdeveloped, then that lower jaw will shift back so that your teeth can come together. But when you see that jaw shift back, now what happens is all of those muscles that are attached to that jaw have to compensate. And when the muscles have to compensate, we start to get pain. And that's when we start to see TMJ symptoms. The other thing is that if you push on your lower jaw, if you push your lower jaw back, you can feel strain in the back of your neck. And this is why there's such a link between TMJ issues and upper cervical chiropractic issues. They're the same. So the treatment, when we treat TMJ, we of course have to ask the muscles, because the muscles are what's causing the pain. We have to ask the muscles, hey muscles, if there was no teeth involved at all, you have no teeth, okay? You need a denture. You have no teeth. Where does the lower jaw want to live? Where do the muscles want to live? How do we position the jaw in space? What's the relationship between where the top jaw and the bottom jaw is? Okay. Now, if you can identify that position and you can get that jaw joint back on that disc and you know where that position is, then you capture that position. Okay. But the problem is that usually that position is more down. Your jaw would be down and forward. So if you put your jaw down and forward, if everybody does that, and your front teeth are touching now, guess what? Your back teeth don't touch, right? If you slide your jaw forward, now your back teeth don't touch. So I can say, this is the position that your jaw needs to be in for you to not have pain. But you're going to tell me, okay, so I just hold it there? How do I create stability? How do I hold it there? How do I function with this position? I can't just hold it like that. I have to chew my food. So what we do is we basically make an appliance that goes on the lower teeth and it fills in the space. It fills in that gap to give your jaw the stability so that your jaw can hold in that position. Okay. So that's the first thing. That is the first thing. We have to find the optimal position of the jaw. We have to try to get that disc back on, and we usually have to bring that jaw more down and forward and then stabilize. Okay, now that's just the position. And then after you get the appliance, which is, we call it an orthotic, after we get the appliance, we have to make sure that when you are in function, that it allows for the jaw to move freely in all directions. So I see a lot of people that have orthotics. They've seen other practitioners, even practitioners that do neuromuscular dentistry. and they've done all the right things. They found the correct position, but they haven't dialed in the orthotics so that the jaw can freely move. When your jaw can't freely move, what if I say, hey, move your jaw to the right or the left? And you're like, oh, it's really hard to do that. Guess what's happening? Your muscles are activating. So it takes me about 3 hours to adjust. Once I get the orthotic and I put it in your mouth, it takes me 3 hours to adjust that bite, that micro occlusion, that micro bite. That's how long it takes me to dial it in. Most dentists, I will tell you, most dentists, 99.5% or 0.9% of dentists are not taking 3 hours to dial in the bites on their orthotics.
Nope.
I'm obsessed, okay? It is such tedious work, and we're talking about tenths of millimeters here, okay? So there is so much proprioception in your teeth, right? If you bite on a hair in your mouth, like between your front teeth, if you bite on a hair, you can feel it. You can feel that there's a hair, okay? That's a tenth of a millimeter. Now, if you step on a hair, can you feel that? No. That's because the proprioception in your mouth is so much more sensitive than anywhere else in your body. And so that's why you have to take the time to dial in that bite and make it perfect, because we are literally talking about a tenth of a millimeter, which is the diameter of a human hair. It has to be that accurate. If it's off, you're going to know. Your brain's going to know. Your proprioception is going to know. So we have to make sure that that's fully dialed in. We have to make sure that when you slide your jaw forward, because again, we want that jaw to be more forward to recapture the disc and to give those muscles relief. When you slide your jaw forward, there needs to be nothing in the way of that jaw sliding forward. Okay? The front teeth have to completely let the back teeth come apart. And when you go side to side, same thing. So when I deliver an orthotic, yes, I have you bite down, tap, 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 and we balance the bites out. But then what I'm more interested in is actually when you're functioning, when you're chewing, when you're grinding at nighttime, what's going on with this occlusion? What's going on with your bite and the muscles? So I take a long time to dial that in. And like I said, that's really unique. Most doctors that are even TMJ doctors, they're not doing that. So that's something that makes us a little bit different. And the other thing is that, like I said, most people, I do want them working with a chiropractor. I like working with Dr. Scappa. We've done podcasts with him before. Because when you bite down, if you have asymmetries in the bite, or let's say that jaw is positioned back when you bite down, remember the teeth are always going to win the battle because you have to chew your food. Okay? So everything around the jaw joints, the muscles, all the upper cervical spine, that's all going to be accommodating to your teeth position because you have to chew food. Enamel is actually the hardest structure in our body. So that's going to win. And then the crowns, if you have crowns, porcelain crowns, those are really hard. Those are harder than enamels. Teeth have like little shock absorbers. And when you put a really hard crown on a tooth, then that's going to also be very alarming to the muscles. This is why a lot of times people will get a new crown and then they start to get symptoms because that bite's not dialed in. So every time they bite on that tooth, it's just super irritating to the muscles. And then their neck starts to hurt, right? Because all the muscles are linked together. So I do working with chiropractors because a lot of people have clenching and grinding. And I just think that if you're going to spend the time and the money addressing this, you want to be as aligned as possible when you come into my office. And like I said before, I can do a lot with the spine, a lot. But if you have some of these other issues like lower back pain, clenching, grinding, those types of things, you definitely want to work with a chiropractor. And so Dr. Scappa and I have developed a really cool treatment where people will see him and then they come see me and we work together very closely. And anyways, that's always going to be something that I recommend. And if you have a chiropractor that you love working with, then I'm happy to talk with them about, what I'm doing. But my experience working with chiropractors is that most of them really don't understand the jaw. They don't understand the bite relationship. And it feels like to me, a lot of chiropractors are just off in their own little world, kind of like, oh, this is a chiropractic thing. And they don't always love working with a dentist. But if your chiropractor is down and wants to talk with me, then that's great. I'm happy to talk with them. but I'm pretty picky about what I'm looking for when I'm interviewing chiropractors.
So we started
Uh,
this off, and when we were saying, and I said, hey, 1 out of 10. But now, as we've gone through all the different symptoms, the different presentations, right, all the different interconnected, my guess is that it's probably more like 8 out of 10 or 9 out of 10. People have some issue, whether, and again, now there's a big continuum on how it's presenting and the severity, but having some piece of a problem that to be solved, it sounds like this is way, way, way more common than people think, but they're just not really thinking about it as a TMJ, TMD issue.
yes. And 75% of our kids need orthodontics. Why do they need orthodontics? Well, that's because the teeth are crooked. Okay, but why are the teeth crooked? That's a sign that the maxilla and the jaw didn't grow the right way, which means that lower jaw is going to be positioned back. Now, not going to have symptoms, right? So sometimes I look at x-rays and I'm like, oh man, like you must be in a lot of pain. And patients are like, I feel fine. And it's okay. That's shocking. I guess we won't treat you, right? Because you don't have pain and symptoms, right? It's like, why would you treat something if you don't have symptoms? Some people want to be more proactive. Some people are like, I want to treat this if I even have any kind of thing. Or some people want to go into orthodontics. And I'll always figure out optimal jaw position first before I just jump into moving teeth around. Because you never want to make permanent changes to the teeth position, or even if you need a bunch of crowns or something, like, wouldn't you want to build that dentistry in the correct position to support your muscles being happy and to help support a healthy jaw position on your neck and all of those symptoms talk about. So I will very rarely just move right into orthodontics unless I take a step back and stabilize the jaw first. And again, this is so different. This is not orthodontists. They know nothing about jaw. Most of them know nothing about jaw joint TMJ issues, right? Orthodontics they're experts and specialized in moving and straightening teeth. And that's it. They straighten teeth. The problem is that straight teeth doesn't always mean that the jaw and the muscles are happy. So you go through 2 or 3 years of orthodontics to straighten your teeth, but your jaw's in the wrong position and now you have a bunch of pain, like I experienced myself, right? So I'm working with people that have any kind of TMJ issue. Like, I'll screen them, even if they don't come in with excruciating 10 out of 10 pain. I'm looking at these things. Do you get headaches? Do you get this? Do you get that? Because if I just straighten the teeth and do orthodontics, I could make all these things worse. In fact, I could make them have new symptoms. So I don't want to mess with that. And so we always stabilize the joint first. And sometimes for patients that like, but I just want straight teeth. And you're like, that's great. We can do that. But trust me, let's take the few extra months to stabilize your jaw and figure out where the end position is so that then I have a plan and we can then your bite, and you don't have to go back and do it again. Because I cannot tell you how many people I see, braces came off a couple of months ago. Now they're in pain. Their head's all crooked. They're a mess. And I have to literally go back, stabilize the jaw, and then do orthodontics again to correct that. So it's important that we do it right the first time.
Absolutely. And if you're hearing this and you're thinking, that's me. So if you're going through that process, or you've been through that process, or any of these pieces that we've talked about today resonate for you or for your kids, we're here to help you build a more comprehensive, a more thorough, a plan that really works. And because we're going to go deeper, we're going to do it right. It's just the Green City way. It's Dr. T, you're obsessed. You can't not do it the right way. And that means taking some extra steps. But we are here for you. Reach out, come in, let's build your plan, let's create solution.